Hello again, I'm Karen Liberi. We met briefly earlier in the video. I have been a physical therapist specializing in women's health and pelvic pain for 16 years. One of the biggest hurdles for women and men with pelvic pain is finding someone who can make sense of it. When you have been searching for answers to only get responses like, "Isn't that interesting?" or "We can't find any reason for your pain," then the mountain of recovery becomes so much harder to climb because you have no idea where to even begin. Understanding that there are anatomical and physiologic reasons for your pain is half the battle. Pain is so much easier to deal with when you have an understanding of why it is happening. I am hoping the first half of the DVD has set your mind at ease as you now have that understanding. Next, I want to create a mindset for you as we are going through the physical therapy section of this DVD so we can start improving your pain levels. If we view pelvic pain as a threshold of pain, then we can figure out how to effect that threshold to allow for much more agitation without the onset of pain.
I would like to discuss the threshold of pain with you. All of us have some level of threshold of pain in our body. For some of us, we have a very low threshold, which means that any extra little input into our body will set us into pain, where those of us with a higher threshold can accept more input before the onset of pain occurs. So if we take a look at muscle tension, if we have just a little bit of muscle tension, if our threshold of pain is low, then that is going to throw us into pain, which we can see indicated by the light orange bar at the bottom of our girl. Add to that stress, then all of a sudden we are in more pain. If you are also a chest breather, then the chest breathing is going to cue into the fight or flight sympathetic system, winding up our body even more, contributing to pain. If you also have scar tissue from abdominal surgery or pelvic surgery, then the decreased mobility of the scar tissue is going to impact your pain levels as well. And then there are known responses. There can be events that happened in your past that have caused pain. Your body remembers that pain, and so it protects itself in preparation for the anticipated pain. So the known response also clearly filters into our reaction to the pain and our body's increased ability to feel it affecting our threshold. So what if we could move that threshold of pain? This whole DVD is really about ways to change that threshold, where we can have a number of different inputs into our system now and have minimal increase in our pain or prevent pain from worsening throughout our day. So wouldn't it be wonderful if we take a look here, if we have the threshold of pain being really high, meaning that we can have a number of different inputs and it would take a lot before that pain response is felt. So how do we affect this threshold? Well, first of all, if we have muscle tension, then there are flexibility exercises and manual therapy techniques that can minimize that tension. In terms of stress, mindfulness exercises that Alex has already gone over with you in this DVD, and relaxation breathing, which I will show you later in this DVD, can be super helpful in minimizing your stress and reduce its detrimental effect on pain levels. In terms of chest breathing, you will learn more about this later in the DVD, but if we can move from being a chest breather to an abdominal breather, that can help as well. For those with scar tissue, if we can teach you some scar tissue release techniques to allow for increased mobility of the abdomen, all of that can contribute to impacting your threshold of pain. In terms of known response, if we can teach our body that particular activities that have known pain in the past, that doesn't necessarily have to happen, that will be helpful. Through desensitization techniques, including use of dilators, which will be taught in the later chapters of the DVD, this can be achieved.
The whole goal for the physical therapy component of the DVD is to give you strategies to change your threshold of pain. Hopefully by the end of the DVD, you will begin to realize the factors contributing to your pain and systematically work at reducing the negative input. Hopefully what seems to feel like there is no rhyme or reason to my pain will start to have a rhyme and a reason as you can dissect out what is happening in your body. Hopefully the feeling of, I don't know where the pain is coming from, turns to, this is why I am feeling the pain and I can do something about it. Hopefully the global feeling of pain you have in your pelvis turns into an identifiable local area of pain that you can address with the strategies given.
In the following sections, we'll discuss practices that promote pelvic floor health, and we'll teach you methods you can use to restore and maintain proper functioning. We strongly recommend that you find a knowledgeable women's health physical therapist in your area to take you through these steps one-on-one. When you've located the right doctor, they will most likely have a physical therapist on site or can recommend one to you.
Or you can visit the American Physical Therapy Association at apta.org. They have a section on women's health and physical therapists locator. In the locator, you'll want to specify pelvic pain.
I'd like to now introduce the anatomy of the pelvis and pelvic floor. This is the pelvis. My hands are on the hip bones. Here is the pubic symphysis. Here is the last piece of your lumbar spine. This is your sacrum, and here is your tailbone. Your pelvic floor muscles attach from the pubic bone and come all the way back to the tailbone to create a hammock of muscles that give support to our bladder, reproductive organs, and lower bowel. The pelvic floor muscles always have some type of activity to them to offer support to our organs and spine. However, a too tight, tense, and turned on pelvic floor will lose its proper function. You learned that all three organ systems, urinary bladder, reproductive organs, and lower bowel, have associated dysfunctional disorders that can be triggers of spasms and clenching that occurs in the pelvic floor because the body is reacting to either pain or the memory of previous pain. Dysfunctional pelvic floor muscles that clench at the threat of pain can be retrained to gain its proper functioning back again. When the pelvic floor muscles can be controlled and when proper functioning has been restored, pelvic pain can be improved. I think that whenever someone has been in pain for so long, they begin to back burner their pain. They will allow their body to have the pain to push through with the tasks that need to get accomplished for the day. Then, at the end of the day, they are in significant pain. Remember back to the threshold analogy? I am going to teach you ways to address your pain at the time that you have it, so the pain doesn't build throughout the day.